and go from there. All right, so thanks everyone for joining tonight. I'm Hannah Castle. I work in our admission office, primarily on our Manchester campus. Some of you may have spoken to me before, but it's nice to meet you virtually. And here with me, I have a few colleagues, so I thought maybe we could start with introductions and then go from there. So I'll turn it over to Amy.
Hi everybody. So if you have not seen Hannah's name on anything, more than likely you've seen my name on some things. So I'm here on the Worcester campus, representing occupational therapy. And if you did apply to Worcester, then your application would come through me. So also happy to answer throughout this any specific Worcester area or housing questions while we go through this.
I'll go next. I'm Meg Sylvia. I am one of the professors in the School of OT on the Worcester campus. So I just teach on the Worcester campus, but our curriculum is exactly the same on the Worcester and Manchester campus. So I'm happy to answer any questions related to our curriculum, courses, things like that. Thank you for being here. Nice to meet you.
Hi, my name is Maura. I'm a current first year student on the Manchester campus.
Right, great. So that's all of us. So we are going to do a Q&A today. So any questions that you may have, feel free to ask. This is an open dialogue, so feel free to ask any questions that you're curious about. We'll also ask some questions to our faculty member as well as our student as well, so you can learn a little bit more about our OT program and what we have to offer here at MCPHS. So I guess I'll open it up to you first to see if you have any questions, and then we'll go from there. So Lindsay, not to put you on the spot, but
oh, that's fine.
Anything that you are curious to know about?
I actually have a friend who's a freshman there right now, so I've been like chit-chatting with her a little bit. But she lives at home, so I was kind of curious about like housing, living with other students, or if I like found an apartment off campus, is it easy to find like roommates that were in the program? Just stuff like that, like housing wise.
And you're for the Worcester campus, is that right?
Yeah, Worcester Occupational Therapy. Yep.
Okay. Amy, I'll let you take that one.
As I almost just made the mistake of I went to go talk and realized I was still on mute. So on the Worcester campus is a little bit more unique because we have a little bit more space in the city. So we have a little bit more real estate to utilize. So we were able to offer graduate housing. So it's all graduate programs, both here in Worcester, both on the Manchester campus. So you're dealing with graduate professional programs. So we have everything from your typical kind of more dorm room style. It's private bedroom, but you share a common kitchen, living room, and bathroom. So those may or may not be fully online in the fall. I think we'll have some access to them, but those are more like your traditional dorm room style, like furniture. It comes with, you know, a full bed, a desk, you know, small closet. Then we have single units. So we have kind of studio apartment style. If anyone stayed in like a Residence Inn Marriott hotel, like the hotel room with the kitchenette, it's exactly what they look like. So those are all single units. We have 2-bedroom condos. We have 2-bedroom apartments. Those again, private bedroom, shared common space. And we also have the building that your academic program is in Worcester. Actually, it used to be an old Marriott hotel. So we kept floors of the hotel rooms and put in community kitchens for students to utilize. So again, those would be private dormitories, as we call them, but graduate housing. So those are also different amenities, different budgets, different things that you can look at there, and pretty comparable as to what you would find in the city. Worcester is also a big college town, so there's also lots of housing available kind of in those price ranges. Some students really like to take advantage of the on-campus housing because you can roll it into one bill. So if you were, you know, using any kind of like federal aid coming through to the school, your housing bill could be incorporated into that. So sometimes a little bit more convenient, but lots and lots of options. Manchester Also, you know, being in a college town also has lots of different housing. We just have a little bit more real estate here in Worcester than Manchester for housing. That's really the only difference.
Can I ask a follow-up with that?
Yeah.
Do all of them come furnished?
Yes.
I live in an apartment by myself, so I was looking to like try and take some of my furniture. Is that a possibility? Like I have a bed, like I just moved in August because my whole family moved to
Right.
Florida. So I had to find somewhere to live up here by myself. So I had just bought like a bed and all of the stuff that fits in an apartment. And I didn't know if it was a possibility for me to bring that stuff with me.
It's a good question. I can find out. All of our residents, they all come fully furnished.
Okay.
So I can ask if there's a way that we'd be able to remove furniture. I'm just not sure because no one's ever asked that, but
No, that's totally fine.
happy to ask the question for you and follow up with you.
Awesome. Thank you. I appreciate
Yeah,
that.
no worries.
Can I just add that I know beforehand, some of the accepted students, they start like Facebook groups, or I'm probably not using Facebook. I'm aging myself right now, you know, like chat groups. And I know in the past, there are some students right now who are living in Worcester, just off campus. So there is a possibility that maybe you could find somebody in the program who is interested in also living, you know, in Worcester, just technically off campus.
Yeah, I saw, I got the link for the Facebook group. I haven't
Oh.
joined it yet, but
Oh,
I was
okay.
planning on doing so. I was just gonna ask a few questions before joining it.
Sure, yeah.
Yeah, definitely join. That's a great way to find roommates. That's what people in Manchester do too, since we don't have on-campus housing. They'll usually like try to find roommates to like live in the Manchester or surrounding towns in different like apartments and condos just to help cut down on some of that cost. So highly recommend joining. And yeah, we'll definitely accept you into the group whenever you request.
Awesome, thank you. I do have another question. I was wondering with the course load, if it was possible, not possible, but like if students found it easy to have a job while going to school.
I can answer that. So I currently have 2 jobs and I find it very easy to balance both of those. It does get a little bit tricky once there is like some weeks are heavier than others, but there's always ways that you can manage your work. Basically, every single classmate of mine works and we're all doing really well in the program. So I think that there's a good work student life balance as well.
So I just wanted to interrupt 1 quick second. I did send a message for that question and someone got back to me right away. You cannot move your furniture in. So there's not a way that we can remove the current furniture. So I did get an answer on that. Unfortunately, the answer was
Awesome, thank you for checking.
yeah, no
And thank
worries.
you for answering more. That was awesome. Thank you.
Maura, do you want to share a little bit more in terms of like your class schedule, like what it typically looks like on a weekly basis?
Yeah, so the first semester you're going to go to class every day. Classes start at 9. You'll have a 40-minute break between each class. Some days you have 3 classes a day, and some that are, I think the 3 classes a day, they're about 50 minutes long. Then you'll have a break. And then 2 days out of the week, you have classes that are a little bit longer. I don't remember the time, maybe like an hour and 20, something like that. I can't remember. And then you'll also have a break with those. You're out early, you're out by 12:20 or 12:50. The second semester, it's a little bit different. You have a day off. So we have Mondays off. Then you have field work and your labs that start your second semester. So those days you're there a little bit later. I know for me, my field work is a little bit different. So we're a cooking group, so we start a little bit later in the day. So we're out later. Labs, you're out later. I had lab today, so I was out by about 4:20. But you have those Mondays off. Classes start at 9 a.m. Still, you're out by 12:20 if you don't have lab, stuff like that.
Sorry, go ahead.
No, go ahead.
I was
Sorry.
just thinking of just another question, and so I actually just was out recruiting for the past week down in North Carolina, and when I got to talk to a lot of students potentially about occupational therapy, and you know, if I think anywhere we go, a lot of the questions are, well, why, you know, why would I come to MCPHS versus other occupational therapy programs? And one thing that I always think about is I love to follow our students on Instagram because the student accounts actually are really great and I learn so much. And one thing that I always notice is our students are so involved. They're involved in local associations, in chapters. And Professor Sylvia, I just saw a bunch of you down in Tampa doing some really great things. And so one thing that always stands out in my mind is kind of this involvement and how this involvement's encouraged. So I thought maybe you guys could talk a little bit about that and kind of how our students stand out in that spotlight.
Sure. Do you want to talk about like student organizations?
Yeah, I just know that our students are just so involved in a
Sure.
lot of different things. And I'm just always seeing all these great projects that you guys
Sure,
are
yeah.
doing.
So on both campuses, we have two student-led OT focused organizations. The first is SOTA, which is the Student Occupational Therapy Association. And then the second is COTAD, which is the Coalition of Occupational Therapy Advocates for Diversity. And I think these are both optional, but I would say that many of our students get involved. They have different events, guest speakers, panels, different initiatives targeting or focused on really important matters related to occupational therapy, but also the populations we work with, our community. So we really try to get involved in the profession, get involved in our community. So there's lots of activities happening throughout the year. Again, it's completely optional, up to you how much or how little you would want to participate in something like that. But I find most students gravitate towards participating in one, if not both. In terms of some other stuff you may see on the Instagrams, we have very active classrooms, lectures, and labs. We try to have small group discussions, large group discussions, different active-based learning activities, just very hands-on. And so it's really not your typical, you're sitting in a big lecture hall and you're just listening to the teacher talk at you the whole time. That's the complete opposite approach of our curriculum and our teaching approach and our philosophy. So I think that if you were looking for that traditional school, you're probably not going to find it here. But if you're looking for a school that's really interactive and engaging and uses a lot of hands-on learning and active learning, then this is definitely your place to be. Maura, do you want to share, like, did you participate in class today doing the bits and everything else?
Yeah, so today in our methodologies course, it was a very hands-on approach. We were using different assessments, so BITS, which is the trail testing on a television screen that is touch screen. So you go from like 1 to 2. So you're just trying to like match all of them correctly. We're testing grip strength, wrist flexion, extension, that range of motion, manual muscle testing. Trying to think what else. Stuff like that. So it was really informative. We were able to learn some new things and actually get that hands-on experience. Same with our assessments course. We're doing those assessments on ourselves. We're doing a lot of case studies. So we're actually doing those assessments and learning them and how to actually do them in real time, which is really, really cool.
I mean, is it that like every semester follows like a theme too? So like you have mental health in every semester, but some semesters are more focused on like pediatrics, whereas some are more adult. Is that right?
Yeah.
Yeah, so your first semester is really an introduction. You're learning a lot of the foundational skills of our profession, but there's also a big emphasis on mental health and community-based mental health. So you have a couple of courses on that. And we also have research, your first introduction to research as well. And so when we were creating the curriculum, had determined there's such a need for our role as occupational therapists within mental health and wellness. And so we were able to develop a curriculum and really streamline that theme throughout the entire program. So you take a focused mental health course your first semester, but then you will notice in other courses it's sort of woven throughout. So Maura's talking about a methodologies course, and the next semester she's actually going to do her own little research, mindfulness research, and then that will continue to map into the fall. So that's definitely threaded throughout. And then research is really important in our profession. So there's a research-based course throughout, offered each semester as well. The first 2 semesters are, like I said, focused on the foundation skills. And then your second 2, you're getting, your third semester, you're getting more into the nitty gritty of OT. And that 4th semester is when you're really learning about some of the more specialized areas. So you're learning more about pediatrics, cognition and vision. You have a program development course. So it's a nice progression from foundation skills up until more of that implementation and engagement in therapy.
No worries, Megan.
Oh.
Okay, perfect. And then the other question I was going to ask you is, I know, obviously we were talking about it's being a very hands-on program. You do field work,
Sure.
rotations, you do level 1 and level 2. Are you able to
Yeah.
speak to those a little bit further in terms of the different ones that you do, what students get to do during them,
Sure.
where they typically complete them?
Yeah, so in our program, we have 3 level 1 experiences. And the first one is a community-based experience. It's with a bit of like mental health or cognition woven into that. The second one is an adult experience, and the third is a pediatric. And so your first semester, you are actually, you are in classes and you're spending that time really preparing for your first level 1 experience. And then when we get to that second semester, you are in courses, but then also once a week, you're going to be going to a community placement where you're going to be running groups with your peers, with individuals from the community, and you're teaching them different skills. And then in your third semester, you will have your adult rehab placement, and this really parallels what you'll be learning in your course, your adult rehab course. So that aligns very nicely. And then in your 4th semester, you'll have your pediatric experience, level 1 experience. And again, that's when you're taking your pediatric courses. So we've tried to align the level 1 fieldwork with the pediatric courses. Also, something that we have transitioned to this year, all 3 experiences will be, or all 3 level 1 experiences will be a 1 time a week. So you'll go once a week to these placements. So you'll attend maybe like 13 or 15 times throughout the course of the semester. It sort of depends on where you're placed. But this is something new that we are implementing, because what we're finding is students really appreciate being able to learn something in class and then observe it in the field work, instead of just really having that 1 or 2 week full-time level 1 fieldwork placement. They like to be able to bring it back to the class, ask questions, discuss their observations. So we're moving towards that. Oh, sorry, level 2 fieldwork. Level 2 fieldwork, there are 2 experiences, and these are 2 12-week experiences. And this is when you will work your way up from really just an introduction to having a full caseload. And you'll take on whatever the caseload is of your supervisor. You're going to work 40 hours a week. That might be split up between 5 days, 4 days, the weekends, evenings. It really depends on your placement and who your supervisor is and what their schedule is. But that is really to prepare you for your board exam, and pulls everything together that you've been learning for the past 1.5 years. And that is a requirement by our like ACOT standards, our accreditation board that's required. It's required for all OT programs.
Can I ask a question regarding this level 2 fieldworks?
Yes.
So for those ones, like I noticed for the level 1 fieldwork, like you kind of got a variety of different locations and everything. For the level 2, is it more like specifics on what the students are like more interested in and going in like the future? Like I know, like if someone was more interested in working with pediatric patients, is it their level 2 fieldwork more likely going to be with in pediatric cases?
I'm sorry, I should have specified. Great question. So your first level, so you have one level 2, which is pediatrics, and one level 2 that's adult. You may do your pediatrics first and then your adult second, or vice versa. And really what happens is you may be interested in a certain location or a certain setting, and then there's this I think they call it a wish list, where you go in and it's really just like all of the available placements. It's a very standardized process. You know, it's not like we pick and choose who we want to go to certain placements. It goes into the system and you sort of put like your first, second, third choice. And you may be competing also against other students from other colleges who are interested in that same placement as well. But we have a lot of students that stay in the New England area, but we also have lots of students who are deciding to travel back home to different states or to visit family. I just had a student finish theirs in Chicago. I have one next week who's going down to Maryland or Delaware, I think. I have a student that's just at an international placement and they're coming back. So we do have opportunities to acquire new locations as well. Do you live in the area, Lindsay?
Yeah, I grew up here, but now my whole family lives in Florida.
Okay.
It was just like a curiosity thing. It's nice to know that I could potentially
Sure.
go.
Yeah, we're sending a student to a pediatric placement in Tampa or St. Petersburg next semester. So
Cool. Awesome. Thank you.
yeah.
Okay. One other thing before I forget to mention it is a big thing about MCPHS is our interprofessional education. So IPE is what we call it for short. And this is really a great way to connect with students from other programs because I know, you know, you are going into OT, but as an OT professional, you are going to be working with people from other professions as well within the healthcare field. So we do these activities to help you learn how to collaborate with other students from other programs and learn about what they do from their side. Maura, I know you've been a part of some events. Do you want to share, you know, the type of things that you got to do, how you found it to be beneficial for your future career as an OT?
Yeah, totally. So we just participated in our second IPE event just a few weeks ago. It's a campus-wide thing. It's also Worcester and Manchester do it around the same time, if not the same day. So here on the Manchester campus, we have not as many programs as we do in Worcester. So you're still with other professions. So here we have PA, pharmacy, nursing, and OT. So all of us will be in a group. You guys are split up between the whole school. And you kind of just go over what was assigned. So this last IPE was kind of like a book club event. But for OT, it's very beneficial because a lot of people don't know what we OTs do and what we can be doing. So you're educating other people as to what we do and how we can help in a situation. So it's very beneficial for them and us because we can see how we can work together as a team to see what the best interest is for the patient or the client.
Yeah, I'll elaborate on that. I just, as you're mentioning, I just came back from the National OT Conference and I was walking around and looking at everybody's research posters, and I honestly saw at least 10 posters that were focused on interprofessional education. And a lot of these posters were actually talking about how they were having to connect with other universities because their university didn't necessarily offer lots of different healthcare professions, and just highlighting the importance of this. And I think that this is something that's so important, and you may not necessarily realize it right now because you're just trying to figure out, you know, your future path, but just having a few of these opportunities to even explain to a PT what occupational therapist is, or explain to a PA, or explain to an optometrist, and just having the confidence and the skills to be able to communicate, because there's a lot of research that shows the importance of communication in healthcare. There are a lot of unfortunate situations as a result of malpractice and other things that have resulted from breakdowns in communication. So this is something that's really important for any healthcare profession. And so I think it's really great that students just get a small dose of this initially, but they're able to sort of take these experiences and then translate them when they go to field work. And then once you're out into the field, it's a must. You have to communicate with others. So. And I just wanted to go back to Megan's comment. If she ever wants to come, and you know, I'm here, happy to give you a tour of our school. Really, that goes for anybody on here. Honestly, if you can't make it, just send me an email. If I'm here, I'll give you a tour. I just did one on last week, so.
No, I was actually gonna say that.
Call
Feel
it-
free. I'm happy to coordinate it because Professor
VIP
Shelby is
yeah.
wonderful to help us with tours.
The VIP experience, so.
That's why I made sure it was when you were there.
All right. Let's see. I'll try to ask some more questions. I know we have a quiet group tonight. Dr. Sylvia, do you want to share a little bit more about some of the faculty that these students will get exposure to? I know many of them have different specialties and also focus on like research or have done research in different areas. Would you be able to kind of speak more to that?
Sure. So, we, yes, are educators first and foremost, but we also want to make sure that we are connected to the university, we're connected to the community, and also that we are engaged in research that is either going to support the education of our students and future students, as well as support the clinicians in the field. So we all have, aside from teaching, we all have our own research interests. So some of us are interested in education research. I'm doing research on pediatric chronic headaches. So some of the other professors in Worcester, they're doing research on low vision, research on suicide prevention, research on mentorship. I'm trying to think. Who else? So, and then in Worcester, I am Worcester. In Manchester, we have research happening about toe walking. We have research about interoception, so that sensation that tells you I need to use the restroom or I'm feeling full again. So research on that. We've got research happening on virtual reality and using that in rehab. We are also starting research focused on 3D printing because both campuses have 3D printers now, and we've incorporated that into the classroom. And so we're going to be starting some research about the utilization of that as well. On top of that, we also have some community initiatives. So just for example, our school is hosting it's basically called like the New England Fieldwork Coordinator. So all of the coordinators in New England for OT programs are invited to a conference here at Worcester. Dr. Rainville, who is also the site coordinator here, is putting together a program called Grandparents as Caregivers. And so it's really focused on community members, grandparent community members who are the primary care providers for young children and how we can support them. So lots of different involvement in both the university level, the community level. So we're always very, very busy. Looks like Maura, there's a question for you.
Yes, so I can answer that. A deciding factor for me to come to Manchester is I live closer to Manchester. I was actually enrolled in the Worcester program. But I ended up switching to Manchester because I just live closer and I did not want to commute to Worcester every single day. That would be a pain from where I live. And what made me choose MCPHS compared to the other programs in the area was I'm a pathway student, so technically, I don't have my bachelor's yet, but I'm graduating in just about a month. So I kind of took advantage of that 3+2 program, so I'll be done in 5 years compared to the 6 or 7. So just stuff like that. Just I did my research. I really liked MCPHS and just how the values and how you start your field work your second semester in, you kind of get that experience. And then just all the professors are so sweet. They want you to do well. They help you. They find ways if you need help. Open door policy always if they're here. If not, they're more than willing to set up a Zoom with you. Like I just met with the professor today because we have research on one of our or an assessment. So just a lot into one. But yeah, mostly because I was a pathway student, but I also had the opportunity to apply others if I wanted to drop the pathway, but that's not really what I wanted. I want to be out in 5 years and be able to practice and do stuff that I love. So stuff along those lines.
And I'm based in Manchester, so I'm biased towards Manchester. But it's a small community over here in Manchester. We have roughly around 400 students total studying at our campus. We have 4 different programs. So besides OT, we also have pharmacy, we have a PA program, and then we have a nursing program. So you really get to know students from the other programs. Not to say that you don't at Worcester, you definitely do. They just have more programs, so there's going to be more students around you in Worcester. But the area in Manchester is great. I've lived in Manchester and the surrounding towns before, and there's a lot to do. You're right, in the center of New Hampshire, where you're surrounded by a lot of different things. Like you're an hour from the beach, you're an hour from the mountains, you're only an hour or so given, give or take depending on traffic from Boston. So you really can't go wrong. There's something for everyone in the area. So if you're kind of tossing between the 2 campuses, I mean, feel free to tour around, the campuses and see what campus feels, more like home for you. All right. Any other questions that you guys have? Oh, Lindsay, you have a question?
Yeah, just to kind of go off of that, about how big are the class sizes at the Worcester campus in comparison? Because I figured they might be a little bit bigger since there's a little bit more students there.
Do you want me to share?
Sure.
Okay, so the largest the class will be 45 students, so it's capped at 45, and we currently have 44 this year. So this is Worcester's 3rd cohort since opening. Our first year we had 16, and then we doubled to 30, and then we're now on to 44. So the classes, I know that Hannah and Amy would not give me more than 45 students because it's a lot of grading. So yeah, I would say, no more than 45. Cool. And Lindsay, you said you know somebody that's a first year right now?
Yes, Marissa Canisi.
Okay.
Yeah, I don't know if you know her, but she's.
Oh, I know Marissa.
Yeah.
Just had
Yeah.
Just had lab with her, so.
she graduated with my my sister. My sister's actually in school right now for speech pathology over in Syracuse. So
Well,
yeah,
I'm sure she can fill you in.
yeah, I was texting her as soon as I got in. I was like, "Can you answer some questions for me?" That's why I've had a lot of questions answered by her, and it's been nice just to be able to like talk to someone about it and
Yeah,
get everything. But you guys have definitely been able to answer a lot more of the questions. So thank you guys.
of course.
Maura, I wanted to go back to what you were saying too, because I know you originally started at our Boston campus in your undergrad courses, and now you're doing grad courses. Um, in your opinion, what's been kind of like the biggest difference as like a professional graduate student compared to undergrad?
Um, I feel like, oh gosh, because I feel like they prepared me very well in undergrad for this as well. Oh, I don't know, because I came from a smaller class too, so we all kind of knew each other, so we're very close here as well. Um, I don't know, I feel like MCPHS kind of just prepared me well in undergrad as well. Probably the less students here, because the Boston campus is very large. So yeah, stuff like that.
Are your study habits any different? Like, do you find that you did things a little bit different in undergrad and then now you know, don't use flashcards or something like that? Like, is there any like differences that you would say?
Yeah, so we study a lot in groups. They actually recommend that we study in groups because it's shown to have a better significance towards the students because you're kind of feeding off of each other. So there's a rule by one of our professors is 3 ways you ask before you come to me. So you can help or get other people's point of views. And if they don't know also, like it's kind of good for the professor to know that it's not just one person that is, there's like quite a few. So they'll kind of go over that again. Definitely studying in groups. I feel like recently I've been doing better as if I like write things down multiple times and then I like remember it better. But undergrad, I feel like I was very good with like the index cards. So yeah, just studying in groups because everyone wants to do well.
Can I elaborate on
Yeah,
that a little bit?
yeah, go ahead.
I've found that I have many students in my office who just say, truthfully, like this is just a different experience than undergrad. And they're like, I don't even know how to study. Like, I don't even know where to begin. Like my strategies that I was using prior are not working now. And I think that one of the benefits of having sort of this close-knit school is that we can sit down with you and talk things through with you and say, okay, what's your learning style? What are your preferences? Let's talk about some different ways we can try to approach these topics. And then also just wanted to put a plug in for some of our resources through the university. If you are interested in taking advantage of, they have, I always see different classes posted or drop-ins. If you need support with studying or, you know, anything, you can absolutely take advantage of those free resources. It's confidential. We don't get like an email that says, oh, your student attended, you know, so you can use them however you want. They're free to you. I recommend students take advantage of that as much as possible, just because they're there for you. Like that's literally the purpose of that program. Is it CASE? We call it CASE. Yeah.
And also, if students need any kind of academic accommodations, is covered by the school. So we have full services, full mental health services for any students that may need it. And Professor Sylvia, correct me if I'm wrong, we have peer mentors in the
Yep.
OT program as well, correct?
Yep, absolutely.
Yeah.
Yep. So
For any kind of like tutoring, peer mentors, academic tutoring, peer tutoring, I know is offered through CASE as well. So a lot of different avenues for support and extra layers of support through grad school.
I think the biggest thing is that we want our students to succeed. And if you come to us and you're telling us, you know, that you're trying as hard as you can, it's just not working, we're going to help you figure it. If you're putting in the effort, we want to help you succeed. If you're coming to us and you're struggling because you haven't opened the textbook yet or you haven't done, you know, like that's a different conversation. But you know, I think that above all, we want our students to succeed and we want our students to enter this field. So I feel like our program goes above and beyond possibly what some of the other programs might in terms of how much support we provide our students, but I might just be biased, so.
No, you're definitely true. I mean, it definitely shows in the numbers too. Like I think there was like a study that recently went out to our recent grads that like within 6 months, 100% of them had jobs. So it just goes to show that, you know, our students are doing really well in the program and that they're set up for success, not only during the program, but also post-graduation too. Dr. Sylvia, are you able to share kind of some areas? I'm sure you probably keep track of it, in terms of like where students are working post-graduation, like the areas.
Sure, yeah. I actually I'm trying to gain access to this new data collection system that the university is doing, that it actually tracks exactly where all of our students are, you know, but I don't have access to that yet. So I can't give you exact details, but I do know just from talking and connecting to some of my recent graduates, I have students that are in adult mental health, early intervention, school-based, acute care, pediatric, just sort of like sensory gyms and sensory clinics. I also just had my second years just finished their first round of level 2 fieldworks, and I've received many emails that they want to offer me a job after I graduate. So that's always really exciting to hear. So yes, many students are offered a possible position upon graduation if you connect with them or if you do a great job and it's something that you're interested in, they're interested in you. So it's not uncommon also for many of our students to actually get offered positions before they even graduate.
Yeah, the field's not going anywhere. I think I was
No.
looking at the top like healthcare jobs in 2024 and OT was number 4. So it like climbed the ladder this year. So we definitely need OT professionals. But yeah, there's so many different areas that you can go into. What would you see as kind of like the biggest rewards and some of the biggest challenges in the field of OT?
I'll start with the challenges. I think that healthcare in general is a challenging field. There are many challenging fields, right? But healthcare in general is just a challenging field. It's demanding from many different perspectives and angles, but also I think as OTs, and this happens with PTs too, just much of our treatment is driven by insurance. And so we're really trying to advocate and have more things covered and be able to support our patients more. But I definitely think that that's a pretty big challenge that a lot of rehabilitation professionals are up against right now. So there's a lot of advocacy happening with occupational therapists, just trying to get more reimbursement and advocating for our populations. And, hospitals don't close, they're open 24/7. So you may have a schedule that requires you to work on weekends or to work late in the afternoon. And I think the benefit of the profession, though, so some of the pros is that you could work in a particular setting for a few years and then transition to something different. So you could work with adults and then you could transition to pediatrics. You could transition to a specific diagnosis or a different setting. And it's really viewed as gaining more experience. It's not necessarily looked at as like you can't keep a job or you can't hold the job. I think that we all understand that healthcare is very demanding. And so it's important that you come to work every single day. You're caring for patients, you're giving your best, you're able to be there physically, mentally, emotionally. So we want to make sure that everybody is healthy. And so I think being able to transition is really exciting because when you're feeling a little bit of that burnout, or you're feeling like, oh, I want to move in a different direction, you can pivot and you can do that. And that's great. I really think, I know, sorry, I'm talking so much, but I think that the best thing about our profession is that it is so inherently rewarding when you're working with these clients and you see them make even the smallest amounts of progress and you see the change that you've made in their lives or in their families' lives. that is what keeps you coming back every single day, despite your schedule, despite your busy caseload, despite the documentation, despite the insurance. Just having the connections and seeing the progress that your clients are making, that's what brings you back every single day. So, all right, I'll stop talking now.
No, I love it. Maura, why did you choose the field of OT?
I chose the field of OT, so I was actually in a different major before I switched. I was in a radiation therapy major, and that was not for me. I tried it, switched, and then I came here, and I actually saw my Nana's recovery. So she fell and she broke her femoral head and her hip. It was a very traumatic time for our family, and just seeing her being able to do a lot of nothing, and she was a very active person, and just seeing what that OT could do to help her with the modifications to adapt and just get better to be basically 100% was something that was an eye opener for me, and it was happening right as my transition from switching my major. So just seeing that and having that validation of like, oh wow, that's really something that I want to do, and being able to help people has always been something. I know that's very generic and everyone wants to say that, or everyone says that in healthcare, but just being able to be part of that person's recovery process and knowing that you played a role in getting them back to being to where they want to be, it's very fulfilling. And to see that with my grandmother was something that I was very happy to see.
I love that. Such a sweet story. Looks like we did have a question come in. So Megan wants to know, do you know of any students working in spinal cord rehabilitation or classes specifically on spinal cord related injuries and disabilities?
Yeah, sure. So you learn about spinal cord related injuries in adult rehab. So that's going to be in the summer. So your third semester, you'll learn about that. Dr. Detwell, on both campuses, we have a panel of individuals come in, share about their experiences, their lived experiences. And there may be, depending on where you're placed or where you're interested in, it could be an option to have a level 2 fieldwork experience specifically on a spinal cord injury unit or floor or in a rehab facility. So if that is something that you're interested in, you could absolutely move in that direction. We do learn about it in depth, or you do learn about it in depth your third semester, and you'll get lots of opportunities to talk to other individuals. And actually, last year, because of the panel, we are actually connecting with a program that takes place at Spalding Rehab, which is in Boston. So we are having students be able to participate and volunteer in their spinal cord injury program at Spalding. So
I'm also going to jump in and plug in soda. I know for our Manchester campus that we've had a guest speaker who currently has a spinal cord injury, and we learn about, or he came in and just talked about what his life has been like since the accident. So that's where a lot of the guest speakers come into play, and you as a student have a say in what we do. So definitely advocate for those types of things when SOTA does ask you, or even COCHAD, when they ask you what you're interested in, to have for guest speakers, whatever you're interested in doing outside of school or what you want your profession to be like after.
All right. Any other questions that you can think of that you may have?
I have a question. Do you feel like the students are like close, like kind of like, I guess you would say friends, or do you feel like it's kind of more just like they go to class, like take classes and then leave? Because right now, I'm at Merrimack, my classes are really small, and I feel like we're all really close, and that like has helped me get through a lot of my undergrad classes.
Maura, do you want to share from a student perspective, and then I'll just share
Yeah.
some faculty observations? Okay.
So I can speak for our Manchester group that we're very close. Like today we had a huge gap between our labs, and a group of us went for a walk. It's nice out. This isn't the first time that we've done this. we go and get lunch. At the end of last semester, I couldn't make it, but a large group of the students, they went out to celebrate the end of their first grad year or grad semester. So I know here that we're very close, and we've gotten very close just within that first semester. So yeah, you're definitely friends with everyone.
And I
I
would
would
say
just-
that's similar to Worcester too. Professor Sylvia, I know you're on our Worcester campus, but
Yeah.
I notice everyone moves in groups here in Worcester as well together as kind of a pack as well.
Absolutely. I would say that um you are also blended into groups for various, I'll just randomly I'll use a randomizer to randomly assort students. So you're not working with the same people all the time, but I will say there are definitely groups of friends that have connected, and also it's not just like, it's not necessarily clicky. These group friends will hang out with these friends, and that's actually what I really appreciate most of, well, not most, one of the things I appreciate most about this university is how close all of our students are. I know all of my students, I know them by name, I know a decent amount about each of my students. That's really important to me to have that connection. I will say, if you are a person who doesn't like to hang out in groups a lot, you will have to do group work. That is absolutely an expectation, but you're not forced to have friends here. If you want to come to class and then leave after, that's totally fine. So I would just know that there is definitely an element of group work that's required, but we would never force students into having friendships, though it is definitely something. I had a group last year. Every Wednesday they had pickleball club. So in the summer, after class, they would go to a local pickleball court and play for a couple of hours. And that's what they did all summer. I had another group that stayed after class, and they would cook different foods that were comforting for them. So one, night was pho, one night was ramen, and so we just had like different cooking groups. Some groups stay after, students stay after, they bring their Wii or video games, connect it to the big screen, play for a little bit just to hang out, relax. So
You're also following each other as like one cohort too.
yes.
So like all your classes are together as like one cohort. So you're going through it together. Your labs may be separated into smaller groups,
Mhm.
but everyone is together for that lecture. All right, any other questions? I don't want to take up too much of your evening. All right. Well, if you think of any after today, feel free to reach out to Amy, myself. We can also put you in touch with our OT department, current students. So let us know if anything pops up along the way. And if you're planning to attend the open house, either at our Manchester campus this Saturday or in Worcester, which is going to be taking place on April 27th. We're excited to meet you in person. It should be a good event. But yeah, let us know what other questions you have as they pop up, and hopefully we'll see you in the fall for our incoming cohort. But thanks again for joining. Appreciate you taking the time out of your day. And if you're local, stay safe in the snow. It's supposed to snow, at least here in New Hampshire. I don't know about Massachusetts.
Yeah, I'm
But
not sure how much we're really gonna get. I'm gonna stick with that theory in my mind of it's really not gonna do much for us. Fingers
I'm
crossed.
supposed to get like 6 to 12 inches where I am. So
Wonderful.
wish me luck. All right. Well, enjoy the rest of your evening. Thanks again for coming, and to our faculty and student. Thanks for sharing all that you have shared about the program and your experiences. We appreciate it.
Good night, everybody.
Of course. Bye,
Thank you,
everyone.
guys.
Thank you.